For years, we've been told routine health checkups are essential after 70.
Right. The doctor schedules them, reminders arrive in the mail, and it all feels automatic.
And on the surface, it makes sense. Catch problems early, stay safe longer.
Exactly. But here's what almost never gets mentioned. Some of these routine tests can actually do real harm.
That's right. Tests your doctor says you need can push seniors toward unnecessary surgery, stroke, or even cancer.
Now, here's where it gets uncomfortable. New studies show that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects.
And believe it or not, 99% of people over 70 have no idea they're being overtested.
And this next part surprises almost everyone. One of the checkups on our list, the #1 test, causes 5% of all cancer cases in the United States.
Yes, the same number of cases caused by drinking alcohol every single day.
You won't hear this in your doctor's office. You won't see it on a billboard, because the truth is buried in the science.
And today, we're uncovering it. We're breaking down the 5 health checkups you should avoid after 70, and the disturbing truth about what they can quietly do to your body, all backed by real research.
And wait until you see what made it to #2.
Before we begin, tell us where you're watching from, your age, and whether you've ever regretted a test or medical procedure. Do you think seniors are tested too much?
We're reading and replying to every comment with personalized advice.
Full video link is waiting for you in comments. Now, let's start with the first test. It looks harmless. Most people agree to it without a second thought.
But it may quietly damage your quality of life.
Number 5 is the bone density scan. It sounds harmless. A quick scan, no pain, no needles. You walk out with a number and some peace of mind, right?
Not exactly. Here's what rarely gets explained after 70. A bone density scan, also called a DEXA scan, often creates more fear than benefit in older adults.
That's because bone loss is a normal part of aging, just like wrinkles or gray hair.
Exactly. And yet, in people over 70, especially women, these scans almost always come back low, even when there's no real fracture risk.
And that's where the trouble starts. Many seniors are immediately prescribed drugs called bisphosphonates, meant to strengthen bones.
But these medications come with serious risks.
Jaw necrosis, where the jawbone begins to deteriorate. Esophageal irritation, digestive problems, and oddly brittle bones that can break in unusual ways.
Now, here's the part that surprises most people. Large studies show that treating mild bone loss after 70 barely reduces fractures at all.
One major study following over 1,200 women found fracture risk dropped by just 0.3% after 5 years.
That's not nothing, but it's far from life-saving.
What did increase? Side effects. A lot of them.
Take Rose, for example. She was 76, active, walking daily, no falls, no pain.
Her scan showed osteopenia, mild bone loss, not osteoporosis.
Still, she was started on medication.
Within months, she had severe reflux and jaw pain. She even stopped playing piano.
Once the medication was stopped and she shifted to vitamin D, weight-bearing exercise, and calcium-rich foods, everything changed.
A year later, stronger legs, better balance, and no fractures at all.
And the science backs this up. Lifestyle approaches like strength training, balance work, proper nutrition, and correcting vitamin D deficiency reduce fracture risk by over 20%.
That's far more than medication ever showed in this age group.
So don't let a number on a screen scare you into treatment you may not need.
Because coming up next is a scan that can lead to something even more frightening.
Let's talk about that next.
Number 4 is the brain MRI for memory loss.
When seniors feel more forgetful, fear kicks in fast. Fear of dementia, fear of Alzheimer's.
Exactly, and doctors often respond with a brain MRI. It sounds reassuring. A detailed scan, clear answers.
But here's the uncomfortable truth. In people over 70, MRs rarely give the answers patients are hoping for.
Most scans simply show age-related changes, slight shrinkage, white matter spots.
And yes, those are normal in older adults.
But once those spots show up, everything changes.
They trigger fear, more tests, sometimes even surgery.
and none of it may improve memory. Some of it can actually make things worse.
A 2021 study reviewed over 3,000 MRIs in adults aged 70 to 85 with mild memory complaints.
86% showed some kind of abnormality, but only 3% were linked to a treatable condition.
That means 97% of people were told something looked wrong, when it wasn't.
And nearly 12% were sent for invasive follow-up tests like spinal taps or biopsies.
Take George. He was 74, sharp, independent. He misplaced keys, forgot names occasionally.
His MRI showed white matter changes.
He panicked, stopped driving, stopped socializing.
His memory actually got worse from anxiety alone.
When we tested him properly, his cognition was normal.
Those MRI findings? Age appropriate.
With better sleep, hydration, and simple brain exercises, his memory stabilized.
He felt like himself again.
The truth is, without severe symptoms, like seizures, sudden personality changes, or rapid decline, MR is usually aren't helpful for mild memory loss.
A simple cognitive screening test is often a better first step.
Now brace yourself, because the next test is one most seniors have had more than once.
Number 3, the cardiac stress test.
It's one of the most common tests ordered for seniors who feel tired, a little tight in the chest, or just not like they used to.
And on paper, it sounds smart. Walk on a treadmill. Monitor the heart. Look for blocked arteries,
But after 70, this test often creates more problems than it solves.
especially in people without clear heart symptoms.
Here's why. In adults over 70, stress tests have a false positive rate as high as 40%,
That means the test says something's wrong when it isn't.
and those false alarms don't stop there.
They lead to angiograms, stents, even bypass surgery.
A major study found that over half of stents placed after stress test referrals were done in people with no real benefit.
No longer life. No better quality of life. What they did have were higher risks of bleeding, kidney injury, and long hospital stays.
Raymond was 75 and active. He mentioned feeling tired on hills. His stress test was unclear. So he was sent for a catheterization. A mild narrowing was found. A stent was placed.
That night, he had a reaction to the contrast dye. Kidney problems. 6 days in the hospital.
And the fatigue?
It never changed.
Because it wasn't a heart problem at all.
If you're over 70 and not experiencing classic symptoms, like chest pain with activity or true shortness of breath, a stress test may do more harm than good.
Often safer options come first. A resting EKG or a coronary calcium scan. Simpler, lower risk.
And far less likely to push you into a procedure you never needed.
And coming up next is a test nearly everyone accepts without question.
Number 2 is the colonoscopy.
And yes, this one surprises a lot of people.
Colonoscopy sounds responsible, preventive, life-saving.
But after 70, and especially after 75, it's often not the smart choice people think it is.
Unless there are clear symptoms, the risks rise sharply with age.
And it starts with the preparation. Strong laxatives, dehydration, dizziness, even kidney problems.
Then there's the sedation. In older adults, it carries real risk to brain function and heart rhythm.
And the procedure itself can cause bleeding or even tears in the bowel.
Now, here's the data most people never hear.
A massive 2019 study followed over 1.3 million adults over 70.
For every 1,000 colonoscopies done in people over 75, only 2 lives were saved.
But more than 20 people suffered serious complications.
That's a 10-to-1 risk versus benefit.
And even when polyps are found, many are slow growing and harmless at this age.
Removing them can sometimes do more damage than leaving them alone.
Dana learned this the hard way.
She was 73, healthy, active, no symptoms, no family history.
Her doctor urged a screening colonoscopy.
A small polyp was removed. She went home. That night, she collapsed. A bowel perforation. 9 days in the hospital, 10 pounds lost. And she was never quite the same again.
When her records were reviewed, she'd already had 2 clean colonoscopies.
There was no reason to repeat it.
Current guidelines recommend stopping routine colon cancer screening at 75 for most people.
And for those who still want screening, stool-based tests done at home are often far safer. No prep, no sedation. and they still catch most concerning cases.
Ask about alternatives, because once you're in the colonoscopy pipeline, it's hard to step out.
And now we've reached the most overused and most dangerous checkup on this list: full body CT scans.
These scans are often sold as peace of mind, executive checkups, preventive imaging.
But here's the shocking truth.
They expose your body to very high levels of radiation. One scan delivers the equivalent of hundreds of chest x rays.
And in adults over 70, the risk of harm skyrockets.
Not because of what they find, but because of what they might find.
A 2023 analysis showed that CT scans may now be responsible for up to 5% of all cancers.
That's the same level of risk as alcohol.
Let that sink in.
1 out of every 20 cancers may be caused by a scan meant to prevent disease.
And it doesn't stop there.
Full body scans often detect harmless nodules or cysts, normal signs of aging.
But once they're seen, panic begins. More scans, biopsies, surgery.
Marcus was 80, active, teaching martial arts. He felt great. A full body scan found a tiny nodule. That led to oncology visits, more imaging, and a biopsy.
The result?
Benign. But the biopsy collapsed part of his lung. 2 months of recovery, all for something that ever needed attention.
Medical experts are clear.
Full-body CT scans should never be used for screening in people without symptoms.
Targeted imaging makes sense when symptoms exist.
But scanning everything, just to look, creates more danger than protection.
So here's the takeaway.
5 checkups that seem helpful, but can quietly harm you after 70. Modern medicine is powerful, but sometimes less truly is more.
Before any test, ask one simple question. What happens next if this finds something? If the answer is unclear or unsettling, it may be time to pause.
Real prevention doesn't start with machines or scans. It starts with lifestyle, stay active, eat well, sleep deeply.
And choose your checkups wisely.
And if today's video got you thinking, there's another one you shouldn't miss. It's called 10 Blood Test Mistakes Seniors Over 60 Make.
It connects directly to what we discussed, especially how timing, supplements, and common medications can completely change test results and lead to unnecessary worry or treatment.
You'll see it on the screen now.
If content like this helps you feel more confident about your health, make sure to subscribe to Longevity Steps YouTube channel.
We share clear, practical guidance to help you stay strong, sharp, and independent as you age.
Now, we'd love to hear from you.
Have you or someone you love ever gone through a test or treatment that turned out to be unnecessary?
What happened? Share your story in the comments. Thanks for watching, and we'll see you in the next video.